Okay. C and ET. Okay. Today's only the subject introduction. Today I'll not start any classes. Today's only for introduction class. Okay, only introduction class, and only giving the some of the I will tell some of the brief, and will give some of the brief about the C and ET subject introduction. This is one of the subject in second year. QP question paper code is 1765. 1765. Theory 75 marks and practical. Okay, practical higher, that is 25 marks. Total 100 marks paper. Okay, total 100 marks. 1765 QP code, and subject name is C and ET. Okay, C and ET. Okay, here is second year B.Sc Nursing. What is C and ET? Anyone? Any guess? Unmute yourself and tell something about C and ET. Anyone? C and ET. Unmute yourself. Who know the answer? Unmute yourself and tell the answer.
Communication and educational technology.
Okay,
Communication and education technology, sir.
Good. Veda, good. Okay, see, good. That is communication and educational technology. Educational technology, that is C and ET, that is full form. Okay, C for communication, and E for educational, and T for technology. Okay, C for communication. Then what is communication? You already read about this one, communication, in first year nursing. I only deal that topic in first year. Communication, definition, meaning, process, and barriers of communication, and how to control the barriers of communication. This all the already I deal in first year. Can anyone tell the answer? Communication meaning or definition, anything? Communication meaning?
Exchanging thoughts, feelings, emotions, etc. to one person to another.
Good. Okay. See, communications. Good answer. Okay, communication, it's the exchange of thoughts or sharing feelings. Exchange of thoughts or feelings or idea from one person or one individual to another. That's the communication meaning. Communication meaning. Okay. See, communication. Okay, the exact meaning or exact definition of the communication is the process of creating or sharing ideas, information, or some views or fact or information, fact or feelings, okay, among the people, from one people to another people, or to people to reach for common understanding. Not only the two people are talking, simply they're wasting time and talking. That is not a good communication. The communication is useful. That is useful. That is useful for the any one of the person or any one of the individual. Okay, that is the creating some ideas or sharing the good thoughts, sharing the useful thoughts or useful information for understanding for the next person. That's the communication. To listen, I'm only giving the subject introduction, not any unit. This is not any unit or not starting any unit. This only the introduction. I am the in charge of subject, in charge of this CET. If you have any doubt in the C&ET or communication education subject, technology subject doubt, contact me or call and clarify your doubts. From tomorrow onwards, I will start review of communication. That is unit 1. Tomorrow onwards, I will start the unit. Today's only I am giving the some introduction, subject introduction. Okay. See, that is the communication. Good, Alisha, Matthew, good answer. Okay, that is the meaning communication. Okay, already know. E for education. Okay, E for education. What's education? Why? What's the use of education, or what's the meaning of education?
Training,
Training.
training of students, people.
Training of the students or training of the people. Good. Next.
Teaching,
Teaching. Okay, good answer. Okay, good. See, education is the training and teaching and learning. Okay, training, teaching, learning, and sharing. Okay, sharing and collecting. See, these are the comes under the education. Education. We know the exact meaning of education. Okay, see the process, the education process is of receiving or giving systematic instruction. Systematic instruction. Okay, in previous days or nowadays already we will tell the uneducated person and educated person ಅಂತ ಹೇಳ್ತೀವಿ nowadays. Educated person and uneducated person. What's the difference between the two words? Educated and uneducated. What's the difference? Hmm? Difference? Educated person know the exact work, they know the process wise. Okay, they will do the step by step. Educated person, step by step and fully processful and systematic manner. They will finish the systematic manner and they will finish the assigned work with their uh, with using their own knowledge or own skills. Okay, and practice their habits, using their habits, using their skills, using their knowledge. Okay, using all the components, the educated person finish the work easily. Uneducated person, they will scratch their heads for finishing that assigned work. They will not use any logic. They will don't know how to finish the work. Okay, that is the difference between the educated and non-educated person. Okay, see here the process of receiving. Okay, process of receiving the education, it's from the school or from the university or from the college or from the hospital or from the clinic or from some of the engineering colleges, for example. That is receiving the education, or from the elder persons for completing the degree or for completing the higher education. It is from receiving the education. They call it as students receiving the education, or giving the education, that is teachers giving, exchanging. Teachers are giving the education in using some of the systematic instruction or using some of the systematic manner. Okay, it is the process of facilitating the learning and acquisition or increasing. Okay, increasing or collecting the knowledge, using some of the knowledge and using some of the skills, and learn how to store the knowledge and how to maintain the skill and values and beliefs and habits. And some of the methods are teaching, training, storytelling, discussion, directed research. Okay, some of the teaching, the teachers are start, not only the teachers in your home, the elder persons or your grandma, your grandfather or your father, mother. Okay, teaching some good things, or training, giving the training will start the training that started at birth. At birth, that's toilet training. Okay, phallic stage, oral phallic stage. There is different stages in the psychosocial development in psychology subject, that's in first year. Okay, there's different stages of psychosocial development. There is a training. Okay, training and storytelling. Storytelling is about some of the storytelling by your grandmother or grandfather. Storytelling, that all they were collecting the information or collecting the knowledge or maintaining the skill. Okay, in compared to the nursing, now you're starting finish just now, you finished the first year, now enter into the second year. In till complete first year, you collecting the how to do the bed making, or what is the bed making, and what is the IV cannulation, and what is nursing, and what is the full form of MBBS, and what is the full form of B.Sc, and what is the vital signs, what is BP. These are all the education knowledge and skill. These are all the converting into the practical. Okay, now theory, okay, you know the theory, you know the vital signs, how to record the BP, you know the BP definition, you know the definition of BP, you know the systolic blood pressure, you know the diastolic blood pressure. Then coming to the skill, you don't know how to record the blood pressure. You don't know how to record the blood pressure. That is differs. That differs. That education is the full bunch of knowledge and skill, not only theory aspect, not only the practical aspect. It is complete bunch of fruits, or it is complete bunch of knowledge, skill, attitude, values, beliefs, habits. Education is not only the knowledge. Okay, education is like a tree. In the tree there is different types of fruits. That's the knowledge, skill, value, beliefs, habits, and learning, giving, exchanging the ideas, or exchanging the good thoughts. Okay, by teaching, or by hearing the teaching, and by learning, by taking the training, it is chain like process. Education is a chain process. Okay, that is chain is connected to one. Okay, that is about education. Okay, that's about the education. Next, T. Okay, T for technology. Any doubt? Hello.
No, sir.
No, sir.
Okay, T for technology. Okay, before we starting in for general meaning for technology, before start any work, we need some of the techniques. Okay, we need some of the machine. Okay, before wearing the shoe, or before wearing the clothes, we need some of the technique, we need some of the tailors for stitches the cloth, for stitches the shoes and the slippers. Okay, we need some of the factories, technology. Okay, that's the general meaning. In compared to the C&ET, or compared to the education technology, in the education system, in the school and in the university or in the college, we already uses the some of the technology. Can give some of the example, anyone? What are the technology we using for the transferring the education, for transferring the knowledge? Anyone example, any examples? That's the technology. Okay, any example for technology? What are the techniques we using for sharing the knowledge? Anything? Anyone?
Computer technology, sir.
Good. Now I think now we are all on track. Okay, good. See, computer technology, or some of the online technology, using some of the using internet. Okay, using internet, or using computers, or using PowerPoint, or using Blackboard. See, these are all the technology. We using the latest model of the technology for sharing, for discussing the discussing the education, discussing the syllabus, for completing your course or for completing your degree. We We have to use the technology. T is very, very important in your education system. Without T, without technology, we cannot do anything. Communication is okay. Good communication, that is okay. Education we must need education. But communication and education without technology, we cannot prove anything. We cannot do anything without technology. Okay, now we can move on. What is technology and meaning? See, technology used to support both teaching and also learning. Not only the teaching, it's also for learning. Okay, it infuse the classrooms with digital learning tools using uh, some of the PPT, PowerPoint presentation, or using overhead projection. Okay, using OHP and computers, using computers or using laptops or using PowerPoint presentation. In microbiology class, you are all watching that PowerPoint presentation. That is one of the technology for teaching and learning process. And handheld devices, blackboard, chalk piece, holding in chalk piece and writing on blackboard. This is one of the technology. Okay, see, edutech, see, educational technology. It is combined use of computer hardware, computer software, and educational theory and practice to facilitate the learning. Both. When technology start and technology will go and mix up and mingle with the education, that is both will create the person will then scientific manner, that will show the complete 100% full person, not 50% learner. It is make a person a 100% person learner. Okay, see, the educational technology is the combined use of computer hardware and software, educational theory using some of the mixing of education and mixing of the technology, the both theory and practice. Okay, theory and practical. I already told in classroom you're learning the theory aspect. Okay, in practical hour. Okay, morning 9 to up to 12 o'clock. You read that theory aspect. Next afternoon 3 to 4, it's a practical aspect. See, both you want both. We need both aspect, theory and practical. That is the education and also technology. Without theory, we cannot do anything. Without practical, we cannot do anything. Like that, without education, we cannot start using technology. Without technology, we cannot complete the education. Okay, clear? Any doubt? Any doubts?
No, sir.
Mm.
No,
Then
sir.
totally we, okay. Then okay, totally we call it as the subject name, communication and educational technology. Okay, communication and educational technology. This is the subject, complete subject name. C&ET, not CET. You don't call subject name. What is subject name? Andre CET, not CET, not CET or not CE and ET. C&ET, communication and educational technology. Okay. Now syllabus. We enter into
sir.
the syllabus. What all the unit? There are total 9 units. Okay, first unit. See, this is about your syllabus. Okay, placement, second year, time, theory is 90 hours. 90. Theory is 90 hours. 30 hours first IA, next 30 hours second IA, next 30 hours third IA. 30 plus 30 plus 30. Okay, in this 90 hours, we divided into the, we leave the 20 hours for the 20, 20, 20, 40. Yes. Okay, total theory is the 90 hours. Okay, see the first unit, see the course description. And slow. Second, see why this subject, what's the use of this C&ET means. This subject is designed to help the students acquire an understanding of the principles, methods of communication and teaching and learning process. There is different principles and different methods of communication and different methods of teaching, or different methods of teaching learning process, TL process. It helps to develop skill in communicating effectively, maintaining the effective interpersonal relations. There is the communication between the two person is called interpersonal relations, and teaching the individual, teaching the community, or teaching the public, and teaching the group, and teaching the some of the disease aspect in the clinical or in the hospital and the community, about the community health and the educational settings. This one we use this communication and educational technology subject. These are all the uses of the subject. Okay, first unit, theory is 5 hours. Okay, theory is 5 hours, first unit. Okay, first unit, that is review of communication process. That is review. You already studied in first year communication, in first unit communication, that is over. Just this is the just review. Okay, just review. Just review, just only the 2 marks questions. Just reviewing the, okay, review. Okay, process, communication process, meaning, elements, channels, facilitators and barriers, methods, techniques. These are all the review of communication process, first unit. Okay, second unit same, 5 hours. There is interpersonal relations. First unit is myself. Okay, review of communication is myself. Okay, from tomorrow onwards I'll start the review of communication process, 5 hours. Okay, next, interpersonal relations I will tell afterwards. I will tell taking this unit. Okay, interpersonal relations, this second unit. This is about how, okay, how the interpersonal relations to be maintained, what's the meaning or what are the purpose and what are the uses of communication between the two persons, what are the uses of that one, and types, what are the different types of IPR, and phases of IPR. In first year you finish, just you know the meaning, just you know, clarify the doubts, and barriers and methods of overcoming the disturbance or overcoming the barriers, and jury window. This is very important, 5 marks question. 5 marks question, jury window. Okay, next unit 3, 5 hours, that is human relations. Human relation. Okay, human relation, this is the relations between the human beings. There is self. Okay, self-understanding and motivations. Okay, this includes some of the psychological aspect, motivation, attitude, and relations in the individual, between the individual and between the groups. Okay, groups. And what are the human relations? What are the human relations in the field of nursing field? What are the human relations in the nursing field? This example, nurse-patient relationship, NPR, nurse-patient relationship. What is the relationship of the nurse-patient relationship, or nurse and healthcare professional relationship? And group dynamics. What are the work we have to do in the group? Okay, and teamwork. Okay, teamwork, that is healthcare personnel work. Radiation technology, for example, in hospital, for example, taking a hospital, the staff nurse doing the nurse work, and doctors, they're doing the checking the patient, and they will tell the what is status of the patient, and they will they will write the medication. That's the doctor duty. Next, nurse follow that duty, and doctor will tell something, do X-ray to this patient. No, now you send the X-ray room to the, okay, now you send the patient to the X-ray room. There is X-ray technician. Okay, radiologist, X-ray technician. There is one of the healthcare professional. Here there are nurse, doctor, X-ray technician, and laboratory technician, and building section, admin department, management, or blood bank technician. See, these are some of the teamwork. Okay, teamwork. See, that is about unit 3. We discussed it in the human relations of these are the sub points. Main topic or main unit name is human relation. These are the subtopics. Next, unit 4 is very, very important. There is a 10 marks question. Guidance and counseling. Okay, guidance and counseling. Unit 1 and unit 2 and unit 4. 1, 2, 4, it is for your first IA. Okay, first IA. Guidance and counseling. This is complete is about the develop basic skill of, okay, basic skill of how to guide the people. Okay, how to counsel the patient. What are the different counseling levels, or what is the different counseling process, and how we organize the counseling service. And there's different types of counseling service. Okay, see, definition, purpose, scope, need, basic principles, organization, types, role and preparation of counselor, issues for counseling in nursing students and practitioner, and counseling process. For example, nursing process, nursing assessment, nursing diagnosis, planning, intervention, rational and implementation. This is nursing process. Like that, counseling process, counseling preparation of the patient, preparation of the patient for counseling. That's assessment. That's framing the patient problem. There is a steps and there is a technique. We deal in that unit. And managing some of the disciplinary problems. Okay, managing some of the problems or management of crisis or emergency time. Okay, emergency crisis means emergency. You have to need immediate attention. Immediate attention. You have to do the crisis management, crisis work. These are 5 marks questions. You can see that is unit 4. Next, unit 5, principles of education and teaching learning process. Okay, this is unit 5. It's about only 5 hours. Okay, education. In this unit, you know you will get full clarification about the education and some of the techniques or some of the teaching points or maxims. Okay, maxims of the teaching. There is, for example, simple to complex, complex to simple, okay, easy to hard, hard to easy. Like that is the maxims of teaching. In future class, you will get to know what are the different maxims of teaching. This is about unit 5, about the education principles. What are the principles of education and teaching learning process? Okay. Next, unit 6. Unit 6 is very important. There is a main long essay. They will ask long essay in this unit only. Okay, methods of teaching, 10 hours theory class and 10 hours practical. All you have to give one lesson planning. You have to conduct the classes. You have to conduct the classes for your juniors in front of your junior. You have to take the in front of your juniors. I mean, first years, you have to take the class. That is the unit methods of teaching, using different methods of teaching. There's a classroom method, okay, clinical method, and classroom method. Classroom, that's lecture method, demonstration group, discussion, seminar, symposium, panel, program, EIC, and computer, and SIM, self-instruction module, and clinical teaching in the hospital side, case method, case presentation, and nursing rounds and nursing reports, bedside clinic, and conference process, and recording and reporting. These are all the methods of teaching. 10 marks important question, or 5 marks 2 questions. Okay, this is methods of teaching, 10 hours class. This is will be taken by myself. Methods of teaching. Okay, unit 1 and unit 6. Next, unit 7. Unit 7. That's educational media. This is one of the very important. This is also 10 marks question. Educational media. Don't write anything. I will share the slide after this class. I will share the slide. You just listen. Unit 7. Total hour 10 hours. 8 hours is practical. You have to do the AVS. You have to prepare some of the charts, flip charts. Flip charts are audio visual aids. Using some of the posters, you have to use some of the chalkboard for presentation. Okay, 8 hours is the practical. You have to do all these things in the practical class. Educational media in the education system. When you start giving the education, when you start teaching in the classroom or in the clinical side, what are the media you use? Okay, what are the media you use? For example, for explaining diabetic diet, for explaining the some of the food and nutrition, for explaining the vitamin food, what are the vitamins and all the vitamins, importance of vitamins, you have to use some of the charts. AV aids. AV means audio visual aids. In this unit, you learn the rules and regulations and uses and disadvantages and advantages of the educational media AV aids. For example, graphic aids, chalkboard, chart, flip chart, graph sheet, posters, flashcards, panel graph, bulletin, cartoons, and projected aids. Projected aid is very important. Slide preparation, OHP. Okay, and making some of the films and making some of the VCR, VCD, and using the beautiful cameras, HD cameras, ultra HD cameras, and making some picture about the health education, and tape recorder addressing the public system, and this is some of the computer. This is some of the educational media. See, less than 1 minute after you have to join early. Next, this is about unit 7. Next, unit 8. Okay, unit 8. There is assessment. Assessment is not patient assessment. It is not nursing assessment. Not collecting the patient subjective data, objective data. Not that one. Assessment is completely different. Assessment is the teacher-student assessment. For example, you're making a question paper. In the assessment unit, you have to do some of the. You have to attend the Viva.